Local nurses are protesting changes at two hospitals. They say patient care will suffer. KCTV5's Betsy Webster tells us the cost-cutting measures being proposed.
Cars honked as nurses lined the sidewalk of Research Medical Center with signs like, "Put patients over profit."
With 6-7 patients, I'm not able to provide the level of care that these patients deserve.
Here's what they take issue with. They say that each unit is staffed on a fluctuating basis based on a grid. The grid basically says for X number of patients, you'll have Y number of nurses, nurses' assistants, secretaries, and so on. Well, last month they say HCA sent them this email saying they'd be getting new grids on June 28th. And in those grids, they say for some units, there are fewer staff members per patient.
They say the change will impact 2 units at Menorah Medical Center in Overland Park and 5 units at Kansas City's Research Med Center. Units like Progressive Care.
If somebody tries to get out of bed and I'm not available and there's nobody that can see them or answer their call light, they're going to fall.
And the ICU.
You're going to lose precious minutes and somebody's going to end up coding and dying.
The 2 hospitals are owned by HCA, a for-profit company that makes billions in profits and got $700 million in CARES Act stimulus relief. A spokeswoman told us, quote, "Research Medical Center and Menorah Medical Center staff appropriately, and our staffing reflects our patient volume and needs, including the fact that we are seeing fewer complex cases such as transplants." She also notes they're not cutting jobs or salaries like others have. This week, St. Luke's Hospital announced furloughs. Children's Mercy announced furloughs in April, noting income lost from less urgent treatments being put on hold during the pandemic.
I would say doing better is still not doing good enough because the hospital has such a huge profit margin.
Betsy Webster, KCTV5 News.